Now this is getting a little bit thicker here, so we're getting closer. Yeah, this is good. Look at, so this is getting close. That's what we're going to be using right there. I want to show you just the fat that we get from liposuction.
Behind the mask. The more you know, the better you look. Behind the mask.
So this is kind of a typical canister full of the liposuction fluid and fat. And so the first thing you'll notice is that there's kind of different levels to this. At the very top is the oil. And so that's oil that has come from cells that have been broken open, and the oil has been released. And so there's always some damage to the fat when we perform liposuction. And that is the damage that's up here. And you can see there's a small amount here. It's not obviously the whole canister. As you move down, these particles are actually bigger up here. And as we move to the very bottom, you see this type of stuff here. These are really fine particles. The drain is down low. And so the first thing that I'm removing are these little tiny particles. And so you can see them here. There's fat cells in here. Just a lot of liquid. It's not really good fat for grafting. If I just kind of dip this sponge in here, you'll see it's very liquidy. And we want something a little bit more heavy, a little bit more chunky, that's really full more of fat. So this device here is connected to here through a little pump. And that's actually how I graft the fat. You can see the consistency here. And this is not really a good consistency that I want to use yet. So I'm going to see there's a little bit of fluid, blood in the tumescent fluid in there as well. So this is not really good for grafting. So I usually drain this for a while and get rid of these small particles until we get down to this really good fat. So even though we do a lot of liposuction, not all of that fat is usable for fat grafting. So sometimes you'll hear people be disappointed with the amount of fat that they received after a BBL, and they'll look at their operative report and say, wow, only 500 cc's was put in, but 4,000 cc's were taken out. What happened to the other 3,500 cc's? Well, this is part of the problem, is not all of the fat is usable. So we have to get down to the good stuff. And this is variable from patient to patient. Some patients will have like a lot of good fat, and some patients will have a smaller amount of good fat. Personally, I'm never really limited by the amount of fat. I don't really, unless we're doing a very skinny patient, I'm usually not limited. I usually do discard some of the fat because it doesn't take as much fat as people realize or people think to be able to get a good result. So I'm going to get to work here, and then I'm going to show you some of the good fat when I'm done. Now this is getting a little bit thicker here, so we're getting closer. Yeah, this is good. Look at, so this is getting close. That's what we're going to be using right there. So that's really important for fat survival, that we're using some really good quality fat. And sometimes it takes a little patience in the operating room to be able to go through and remove that fat that's not really optimum, because we want to hit that sweet spot where we're getting that really good fat, and that's what's going to give good fat survival. And the fat has been sitting here for a while, and it's also on a little vibrational plate, and that helps to decant it and get those bigger fat cells there, which is what we want to use. So, all right, I'm going to get to work, and we're going to use this beautiful fat.